Welcome to Primetime. I'm your host, Nick Kaltzis. I'm joined today, my immediate right, by Todd Sauter and Dr. Peter Weber. Dr. Weber is at UMass Memorial Healthcare, right?
Yes.
You were served previously as Chief Medical Officer for Cochlear Corporation.
That is correct.
And you were the director of the Cochlear Implant Program at Cleveland Clinic.
I was.
Todd, you're an audiologist and the owner of Audiology Associates here in Worcester.
Correct.
On the adjunct faculty of Northeastern University and Worcester State University.
Correct.
You were also at UMass.
I was.
So let me ask you guys, hearing loss. When I say hearing loss, what do you think of? What is hearing loss?
Well, I think of an undertreated problem.
Mm-hmm.
It's a problem that is not very rare at all.
Mm-hmm.
Over 1 in 10 of every American has some form of hearing loss, though a very small percentage of those that have that problem go untreated for various reasons.
And you know, with the aging population, it's going to be way more than 1 in 10, right?
Yes.
As far as people recognizing hearing loss, I bet you there are some people that don't even realize that they have hearing loss.
That's correct. Hearing loss often goes unnoticed because it comes on so gradually in time. It's not something you wake up in the morning and all of a sudden, oh, I can't hear. It's something that very gradually comes on, and as the brain slowly adapts, there's no acute change that people notice. And so rather than waking up and feeling hearing loss or feeling pain, it's just some of the communication effects that take place. You start to notice you're asking people to repeat themselves more often, or people tell you that you are asking to repeat themselves more often. You find you have trouble with women and children's voices. You find you have trouble in background noise.
Now, why would someone have problems hearing women's or children's voices?
Yeah. Well, there's some misconception that is because women and children's voices are higher pitched.
That's what I was going to say.
Yeah, and there's some truth to that. The bigger reason there is that women and children's voices on average are less intense. They're not as strong. The physical structures don't make the articulating sounds of speech as prominent. And hearing loss has a few components. One is a loss of volume, attenuation of sound that's created from hearing loss, and as well as some distortion of sound that's created because of problems in the inner ear. And the softer the voice, the more trouble on average you're going to have.
With respect to other health ailments, how does hearing loss affect someone's overall health? Does it have an effect on someone's overall health?
Absolutely, it can. So there's been a number of studies that have shown that when a person cannot hear, a lot of times what they will do is, and even unbeknownst to them, they'll start to isolate themselves from society. That can lead to depression. It can lead to problems with blood pressure. It can lead to problems in patients who have diabetes with sugar control. When they sit at home, they don't have much to do, they eat more, they feel depressed, and all these things can spiral into a number of other health problems. But the biggest one we see is isolation and depression.
Yeah, isolation is a real problem, particularly with the elderly population. And, like you say, isolation leads to depression, leads to other health ailments.
Leads to a more sedentary lifestyle. Obviously, neuromuscular weakness and fall is a big problem in the senior population, and the isolation, not getting out there, not exercising in that fashion, leads to problems there as well.
I don't think that people in the senior population recognize the prevalence of hearing loss in the senior population.
No, I don't think so. It's, as Todd had mentioned, it comes on gradually. And usually it's a family member or friends that will prompt someone to come and get tested.
When you say come and get tested, what's that mean? What is testing?
I'll let Todd.
Sure. A hearing test, a routine hearing test, is a fairly straightforward process for the patient. You come in, you go through some very simple listening tasks. listening for tones, repetitions of words. There's many objective measures that we do in the ear that don't require someone to do it at all. So it's a very straightforward process, but it's a very easy process.
Okay.
And typically, getting your hearing evaluation is not just a matter of getting the hearing itself tested, but interviewing and get to know the person to see what exactly the effects on their lifestyle are. Because ultimately, in treating hearing loss, it's not just treating an ear, it's enhancing communication, finding out what effects the hearing loss is having on their life and addressing those directly as specifically as we can.
What about someone that's sitting out there that's thinking, oh, I don't want to go in for a hearing test, I'm afraid it's going to hurt?
Yeah.
Does a hearing test hurt?
It certainly does not hurt.
Okay.
When it comes to other diagnostic tests in the general medical realm, it's probably about as simple and pain-free as you can get when it comes to diagnostic testing.
I would assume that if a person has the need for a hearing test and they don't come in and get tested and they let their situation deteriorate so that their health also deteriorates, the thing that they're afraid of is going to come to fruition by virtue of the fact they've delayed going in and getting tested.
Sure. I mean, if anything, there's that, by delaying testing, there's a number of years there that your quality of life has been decreased and you haven't been able to do anything about it. It's very, very common. The average length of time between somebody first noticing a problem and first getting tested, on average, is about 7 years, believe it or not.
I do believe it, actually.
So
I think that problems probably occur earlier in life, kids listening to loud music, going to concerts, hearing things at a volume that hurts their hearing system, which we'll talk more about. But and I bet you don't see a lot of people at a young age coming in and have the hearings tested.
Well, we do see our share.
Okay.
We're here talking, of course, about the senior population, and there's approximately 35 million people in the United States with hearing loss. About half of them are actually under the age of 65. So hearing loss is something that can certainly strike at any point in life. And while it's obviously prevalent in seniors, we do see all ages.
Right. We're going to have to head to a break right now. When we come back, let's talk about how often someone should get tested for hearing loss, at what age they should begin, coming in for hearing testing. We're going to head to a break right now. When we come back, more Primetime with myself, Nick Kalsis, Todd Sauter, and Dr. Peter Weber.